Welcome, dear students. I'm Dr. Hani Nadeem. In this lecture, I'll cover the anatomy of the mediastinum, which is the space situated between the two lungs. First, we have to know what we expect to know by the end of this lecture. At first, you have to be able to define the mediastinum and list its subdivisions. For each subdivision, you have to be able to give the boundaries, the contents, and the relationships of these contents to one another. Regarding the definition, as I just mentioned earlier, the mediastinum is a median compartment in the thoracic cavity between the two pulmonary cavities. It is occupied by the heart and viscera. All of them are connected by loose areolar connective tissue. Regarding its boundaries, anteriorly, we have the sternum with the costal cartilages attached to it. Posteriorly, we have the 12 thoracic vertebrae. Superiorly, we have the thoracic inlet, or better called the superior thoracic aperture. And inferiorly, we have the diaphragm. On each side, we have the pleura and lung. It is subdivided by a plane running horizontally from the sternal angle, which is the junction between the manubrium and the body of sternum, running backwards till the lower border of the fourth thoracic vertebra. This plane divides the mediastinum into two parts: superior mediastinum above it and inferior mediastinum below it. The inferior mediastinum is divided by the pericardium and heart into three parts: anterior mediastinum in front of the pericardium and heart, behind the body of sternum; middle mediastinum, which is made by the pericardium containing the heart; and posterior mediastinum, which lies behind the heart in front of the thoracic vertebrae. Now let's study the superior mediastinum. Let's begin with the boundaries. Anteriorly, we have the back of manubrium sterni. Posteriorly, we have the upper four thoracic vertebrae. Superiorly, we have the superior thoracic aperture. And inferiorly, we have the imaginary plane at the level of the sternal angle. On each side, we have the pleura and lung. Regarding the contents, we can divide them into three groups of threes. The first are three muscles, two behind the manubrium. They are called sternohyoid and sternothyroid. Here they are. This is the sternohyoid. This is the sternothyroid, of course, on each side. And we have a muscle called longus colli, which is a neck muscle situated in front of the bodies of the upper three thoracic vertebrae. The second three is a gland called the thymus gland, which is rudimentary in the adults. It lies behind the manubrium, extending down into the anterior mediastinum, together with some lymph nodes and areolar connective tissue. Then we have three veins. These three veins are the right brachiocephalic vein joining the left brachiocephalic vein to form together the superior vena cava. The point of union of the two brachiocephalics lies at the level of the first costal cartilage on the right side. Each brachiocephalic vein is made by union of two veins, one draining the upper limb, called subclavian vein. The other is draining the head and neck and called the internal jugular vein. In addition to the three veins, we have three branches or three big arteries arising from the arch of aorta. The arch of aorta lies behind the lower half of the manubrium, whereas the left brachiocephalic and the three branches of the arch behind it lie behind the upper half of the manubrium. The three big branches of the arch of aorta are, number one, the brachiocephalic artery, which ascends towards the right sternoclavicular joint to divide into a branch supplying the head and neck, which is the common carotid, and a branch supplying the upper limb, which is the subclavian artery. These two arteries on the left side arise separately from the arch of aorta. That is to say, there is a left common carotid and a left subclavian. So the three branches of the arch of aorta are the brachiocephalic, left common carotid, and left subclavian. Now we have three ducts. Just behind the arch of aorta and its big branches is the trachea. The trachea is made of cartilaginous rings, C-shaped, deficient posteriorly, and behind the trachea is the esophagus. The esophagus begins in the neck, descends in the superior mediastinum, passes behind the heart, in the posterior mediastinum, passes through the diaphragm to end in the stomach. Just behind the left border of the esophagus, here is the esophagus, just behind its left border, this green duct is called the thoracic duct, which is a lymphatic duct that drains the lower half of the body below the diaphragm, passes through the diaphragm with the aorta, ascends in the posterior mediastinum, superior mediastinum, and then into the neck, where it drains at the junction of the internal jugular vein and subclavian vein on the left side, where they unite at this angle to form the left brachiocephalic vein. We have three nerves as well here. The two vagi, the two phrenic nerves, and the left recurrent laryngeal nerve. The two vagi, the right vagus descends on the right side of the trachea and then makes a plexus around the esophagus called esophageal plexus. The left vagus descends between the two arteries here, the left common carotid and left subclavian, and then on the left side of the arch of aorta, and then joins the right vagus to make the esophageal plexus. The two phrenic nerves, the right, these two nerves arise in the neck, they descend all the way to pierce the diaphragm supplying it. The right phrenic descends on the right side of the superior vena cava. The left phrenic, as the vagus, descends between these two arteries, the left common carotid and left subclavian, and then on the left side of the arch of aorta, and descends on the heart to pierce the diaphragm. The left vagus nerve gives a branch that winds below the arch of aorta to ascend in the left groove between the trachea and the esophagus. This ascending branch ascends up with the trachea and esophagus till it reaches the larynx. That's why they call it left recurrent laryngeal nerve. There is a right recurrent laryngeal nerve, but it's present in the neck and does not descend into the thorax. Now let's come to the anterior mediastinum. At first the boundaries and then the contents. The boundaries are anteriorly the body of sternum. Posteriorly we have the pericardium and heart. Superiorly we have the imaginary plane at the level of sternal angle. Inferiorly we have the diaphragm. On each side we have the pleura and lung. The contents are the remains of the thymus gland. As we said, the thymus is present in the superior mediastinum and it descends into the anterior mediastinum down to the level of the fourth costal cartilage. In addition, we have what's called superior and inferior sternopericardial ligaments. These are two small ligaments that attach the fibrous pericardium to the back of the body of sternum. We have mediastinal branches of the internal thoracic artery that descend with the phrenic nerve. And we have loose connective tissue, fat, and lymph nodes. Now we will cover the middle mediastinum, boundaries and contents. The boundaries are anteriorly we have the anterior mediastinum, posteriorly the posterior mediastinum, superiorly we have the imaginary plane, inferiorly we have the diaphragm, on each side the pleura and lung. The contents of this mediastinum are the pericardium and heart, and the big vessels that are attached to the heart, the two big arteries, the one arising from the left ventricle, which is the ascending aorta, the one arising from the right ventricle, which is the pulmonary trunk, dividing into left and right pulmonary arteries. Here they are. This is the ascending aorta. These are the two branches of the pulmonary trunk. This picture is after removal of the heart to show the big vessels. We have veins as well. We have the superior, lower half of superior vena cava. The upper half lies in the superior mediastinum. The lower half lies in the middle mediastinum. Okay, and we have the uppermost end of the inferior vena cava, and we have these four pulmonary veins. You may wonder why they are colored red, because they carry oxygenated blood from the lung to the left atrium. In addition, we have the bifurcation of the trachea into the two main bronchi. On each side of the pericardium, we have the phrenic nerve and the pericardiacophrenic artery, which is a branch of the internal thoracic artery. Now, the last part of the mediastinum, the posterior mediastinum, boundaries and contents. Anterior, you have pericardium, and below that we have the diaphragm. Posteriorly, we have the lower 8 thoracic vertebrae. Now, you have to notice that the pericardium and heart lie opposite the middle 4 thoracic vertebrae, that is to say, number 5, 6, 7, and 8. The upper 4 lie behind the superior mediastinum. The lower 4 lie behind the diaphragm. The middle 4 lie behind the heart. Superiorly, here we have the imaginary plane at the level of the lower border of T4. And inferiorly, we have the lower end of the diaphragm. On each side, of course, we have the pleura and lung. Now, the contents of the posterior mediastinum, we have 4 longitudinal structures because they pass, some of them pass from the thorax to the abdomen, some pass from the abdomen to the thorax. 2 structures descend from the thorax, the descending thoracic aorta. While it descends, it gives posterior intercostal arteries. The ones on the right are longer because the descending aorta is slightly shifted to the left. So these right ones are longer and they cross horizontally behind the esophagus here in the posterior mediastinum. The second big structure is the esophagus. And as we said, the 2 vagi nerves make around it the esophageal plexus of nerves. Just to the left side of the aorta here, we have 2 structures passing through the aortic opening of the diaphragm, the thoracic duct and the azygous vein. The azygous ascends all the way until it curves forwards to end in the superior vena cava, back of middle of superior vena cava. As it ascends, it receives the hemiazygous vein and the accessory hemiazygous vein from the left side, and they both drain the posterior intercostal veins from the thoracic wall. Lastly, we have, arising from the sympathetic chains here, 3 splanchnic nerves that pass through the diaphragm to reach the abdomen, making plexuses that supply the abdominal organs: the greater splanchnic nerve, the lesser splanchnic nerve, and the least splanchnic nerve. Finally, we have posterior mediastinal lymph nodes. We have to know the clinical importance of the contents of the mediastinum. Why do we have to remember all these structures and their relationships to one another? Because sometimes we may have a tumor or an enlargement of the aorta or one of its branches. This enlargement is called aneurysm. This may compress the contents of the mediastinum, leading to manifestations that can be felt by the patient or can be elicited on the patient. Compression on the trachea or the main bronchi will cause dyspnea. Dyspnea means difficulty in breathing. Compression on the esophagus may lead to dysphagia, which means difficulty in swallowing. Compression on the left recurrent laryngeal nerve may lead to hoarseness of voice, a change in the voice. These three symptoms are commonly complained by patients having any tumor or any swelling in the mediastinum: dyspnea, dysphagia, hoarseness of voice. In addition, compression on the superior vena cava may lead to engorgement of veins or congestion of veins in the upper half of the body, particularly the neck and the thoracic wall. Finally, compression on the phrenic nerve, or probably invasion by a malignant tumor, may lead to hemidiaphragm as paralysis of one of the leaflets of the diaphragm. Now we will study a 3D rotation model of the thorax in order to see the contents of the mediastinum. As you can see in this 3D model, we can rotate. We can see the two lungs. We can see the thoracic cage. And in order to see the mediastinum, we have to remove the bones in the lungs. First, we will remove the sternum. We have to select it. We remove the thoracic cage. And we will select the costal cartilages and hide them. And finally, we will select the lungs and hide them. Now we can see the contents of the mediastinum clearly. I will clear the bronchial tree as well. And the branches of the pulmonary veins. Now things look much clearer. We will rotate the model now in order to see the mediastinum. Here we are. As we said before, the heart and the big vessels joining it together with the phrenic nerves make the middle mediastinum. Behind the heart we have here the posterior mediastinum. In front of the heart we have the anterior mediastinum, and here above at the level of the arch of aorta we have the superior mediastinum. Okay. Let's see the contents of the superior mediastinum. First of all, we can see here the thymus gland, which extends down till the anterior mediastinum as well. We will highlight it and hide it. Now we can see the three veins, the superior vena cava, made by union of two brachiocephalic veins. The left is oblique, the right is vertical. Each is made by union of two veins: a subclavian vein draining the upper limb and an internal jugular vein draining the head and neck. This is on the right side as well as on the left side. In addition to the veins, we have the arteries. The ascending aorta, as we said, lies in the middle mediastinum below this level. What lies in the superior mediastinum is the arch of aorta. And as we rotate here, the arch becomes the descending aorta in the posterior mediastinum. Okay, the arch gives three big branches, which are the brachiocephalic, it is, which divides into a right subclavian artery to the upper limb and a right common carotid to the head and neck, addition, two other branches rise separately: the left common carotid to the head and neck, and the left subclavian artery to the upper limb. Okay, now we can see three ducts. The trachea. Behind the trachea, we can see here the esophagus. Here it is. Behind the left border of the esophagus, we can see the thoracic duct, this green duct, which actually arises in the abdomen. It enters with the aorta through the diaphragm, ascends in the posterior mediastinum all the way to the superior mediastinum, then curves in the neck to end at the junction of the left subclavian and left internal jugular veins, where they unite to form the left brachiocephalic vein at this angle here. Okay, now we can see the nerves. As we said before, there are three nerves. We have clearly here, we can see the phrenic nerves. The right phrenic descends all the way on the superior vena cava, right atrium till the diaphragm. The left phrenic descends between the two big arteries on the left side from the arch of aorta, the left common carotid and left subclavian, then on the arch of aorta, then on the left ventricle to reach the diaphragm. In addition to the phrenic, we have the vagus nerve. This is the right vagus. It descends here to go on the right side of the trachea, and then it reaches the esophagus to make the esophageal plexus. The left vagus also descends here. At first it was in the carotid sheath in the neck, and then it descended on the arch of the aorta, and then it goes to the esophagus to make the esophageal plexus. Okay, let's see the left recurrent laryngeal nerve. We will enlarge this segment here. Between the arch of aorta, okay, and the, let's reduce the size a little bit, okay. Between the arch of aorta and the left pulmonary artery, there is a ligamentum arteriosum. This is the vagus nerve. This is the phrenic nerve. From the vagus arises the left recurrent laryngeal. It winds around below the arch of aorta behind the ligamentum arteriosum, and then it ascends in the left groove between the trachea and the esophagus. Now we have seen all the structures of the superior mediastinum. Now let's remove the heart and see the structures of the posterior mediastinum. Okay. Now let's remove the heart. Let's hide it. Here we are. Now we can see the four vertical large structures in the posterior mediastinum. We can see the descending thoracic aorta. We can see the esophagus with the vagi nerves making the esophageal plexus. And we can see this green thoracic duct, right? And we can see this vein, which is the azygos vein. The azygos arises in the abdomen, ascends through the diaphragm in the posterior mediastinum. It makes an arch here, which ends in the back of the superior vena cava. Okay. Now it's time to see the contents of the mediastinum on a picture taken from a real cadaver. As you can see here, the heart surrounded by the pericardium and the large vessels emerging from it make the middle mediastinum. This is the heart. This is the superior vena cava, the lower part of it. This is the ascending aorta. This is the pulmonary trunk. Now we can see the structures in the superior mediastinum, the upper part of superior vena cava, left brachiocephalic vein, made by union of left internal jugular and left subclavian, and the right brachiocephalic, which is vertical, made by right internal jugular and right subclavian. The three big arteries coming from the arch of aorta, this is the arch, this is the brachiocephalic artery, this is the left common carotid, and this is the left subclavian. We can see here the trachea. We can see the left vagus nerve, giving the left recurrent laryngeal nerve winding below the arch of aorta. Now the heart is removed in order to see the pericardium and the hidden vessels behind it. We can see here the two left pulmonary veins and the two right pulmonary veins. This is the inferior vena cava, this is the pericardium. Here we can see also the bifurcation of the trachea. You can see the right main bronchus and the left main bronchus. Here we can clearly see the arch and the three big branches of it, in addition to the left vagus and the left recurrent laryngeal nerve. Now, as the pericardium is removed, we can clearly see the vertical structures present in the posterior mediastinum. This is the descending thoracic aorta, giving the posterior intercostal arteries on the left side and on the right side. Of course, the right ones cross the posterior mediastinum. This is the esophagus. This is the thoracic duct. This is the azygos vein. This is the sympathetic chain giving the splanchnic nerves. Now let's get back to our intended learning outcomes and see if we have achieved them or not. Can you define the mediastinum? Can you list its subdivisions? Can you describe each subdivision in terms of boundaries, contents, relationship of one to another? If you can, then you have achieved the goal. Thank you so much, and I hope to see you in other lectures soon.